To begin, I would like to thank all the student volunteers and the M.Sc for helping make this conference possible this year. And with us today is Dr. Leana Wen, an attending emergency physician and director of patient-centered care at research at George Washington University. She went to Washington University School of Medicine and the University of Oxford, where she was a Rhodes Scholar, a former clinical fellow at Harvard Medical School and emergency resident at Brigham and Women's Massachusetts General Hospital. She has served as a consultant to the World Health Organization, Brookings Institution, China Medical Board, was a national president of the American Medical Student Association, and is the author of When Doctors Don't Listen. Now, being her fourth time speaking at our conference, it is with great honor that I welcome to the stage Dr. Leana Wen.
Good morning, everyone. Good morning. All right, I know it's early in the morning and we're a relatively small audience, but I want to first of all thank you for coming today. This is a very special experience for me to come back to this conference. I first attended here when I was the president of the American Medical Student Association. That was back about 10 years ago. And so being able to come back now and to share whatever lessons that I may have learned in the course of being a medical student and resident and now an attending, I'm very glad to be here. And so I hope that I'll have a chance to speak with all of you later on as well. I'll be out in the fair and leading some workshops later, so feel free to come and stop me, and I would love to learn more about you. And so I want to start today by telling you a story. And I'm hoping that this story is one that you will relate to based on your own experiences as well. And this is a story of a girl who is an immigrant from China, who came to the US when she was 8, who then lived in some rough areas in Los Angeles, in Compton, and East LA, and who, because of the hard work of her parents and the dedication of many people around her, ended up going to college and wanting to be a doctor, but had no idea about how to actually do that. She didn't know what grades she should be getting, what tests she should be taking, what clubs to join, nothing at all. And she wished that she could have come to a conference like this, really, to find out about these opportunities. But also at the time, she was told that she couldn't do it. She would go to a pre-med advisor, and the pre-med advisor will say, who do you think you are? Your grades are not so amazing. Even people here who have straight A's and 40 MCAT scores or whatever, they don't necessarily get into medical school, and so why are you trying to apply for Harvard and Yale and all these things? Who are you to think that you can do it? Well, she persisted. She applied, didn't get in to many places, but got in somewhere. And that's, of course, is me, and that's my story. And that's why I'm here today, because I want to tell you that there are things that you can do, that working hard, being persistent, that these are the lessons that you have to take away. And so I know that during this conference, you're going to meet many people, right? Many amazing speakers, I think, who are heads of organizations and who will give you a lot of ideas for what they're doing now. But what I want to share with you today is 8 lessons for what are the things that I wish I had known when I was in your shoes. My first lesson is that there's one word that I want you to keep in mind. That is the most important thing, the most important word of all. And that word is why. Last year when I was here at this conference, I asked students this question, right, who I passed, why are you here? And they would say, oh, I want to learn about, what clubs to get involved with. I want to know about how I can become president of this organization. And I would say, that's important to be strategic, but even more important to ask why it is that you want to go into medicine. What is your story, right? That I told you my story. And I think you can relate to that. Many of you who are immigrants can relate to that story. You all have a story as well. You have a story of why you want to enter medicine. Last year, these students were telling me about how they watched their father die because they didn't have access to care, how they grew up in migrant communities and wanted to be the one doctor there to serve their communities when they finished their training. Know that story. Know your why. That story is what people are going to relate to when you apply to medical school or pre-health or health school of some type. That story, that mission, that's what people will really relate to, and that's why you should keep that in mind. If you don't know your own why, it'll be obvious, first of all, to other people. But even if you're able to fool admission officers or whoever and somehow get into medical school, but actually you're there because your parents wanted you to do it or because you think it's a stable career, you're not going to be very happy. And you should be entering medicine and health because you truly want to serve. So know your why. The second, after asking why, ask what is it that you can do. Being a doctor, being a leader is about what you can do and what impact you have, not about what position you hold or what title you have. And so I talk about this because I have to say one of my greatest pet peeves is people will say to me, well, you worked at the World Health Organization. How can I work at the WHO? Or you led this organization. How can I be president of this club? And I would say that is the wrong question to ask, because you don't want an impressive sounding title just because you think it'll help you get to the next stage. What you want to figure out is what is the impact, the difference that you will make in that role. So you can be writing a paper, for example, on HIV, but really, is that what's going to be making the biggest impact? What about teaching students in your local community about HIV? Or what about helping those that are around you today and making a difference today where you are? Which leads me to my third point, which is to start today, wherever you are, and do not wait for that perfect opportunity. I do a lot of global health work, and currently I'm advising 13 schools across sub-Saharan Africa on medical education and how to build their capacities. I've done a lot of work internationally in China, South America, and Southeast Asia and Africa. And I have so many students coming up to me and saying, well, how can I do global health work? I want to come with you and go on your next trip. And I'm all for people getting involved with global health. I think it's really important to be aware of things that are outside of our own communities. But don't wait until you can go to Africa to make a difference. If you really want to work on HIV/AIDS, I live in Washington, D.C., and we have one of the highest HIV infection rates in the country. If you're telling me you want to work on HIV in Africa, you'd better have done some work in your community today around you. And don't tell me there aren't opportunities to serve, right? Every single area that we live in, here in Northern California, Southern California, no matter where you're from, there are many opportunities for service. So don't let perfection be the enemy of the good. You have to get involved and do things today, because there are so many opportunities to be involved. At your campus, you can be mentoring students. At other places, there are many opportunities to serve, whether it's with religious organizations or with your service fraternities. No matter where you are, there are many opportunities. And so take advantage of those and start now, because medicine is ultimately about service. And serving doesn't have to wait until you can take that 3-week trip to sub-Saharan Africa. It can start wherever you are now. My fourth tip, and related to this, don't confine yourself to service in hospitals. Remember that there are many ways to demonstrate these characteristics that you think admission committees or anybody else may be looking for. So in leadership, for example, all right, I understand that you want to show that you understand, that you know what medicine is about, and so shadowing is important. But honestly, how much leadership can you show by shadowing in a hospital? Right? I mean, maybe you can show initiative, you can show that you can follow directions, but you don't really show leadership that way. Whereas if you can become captain of a soccer team, president of your service frat, I mean, things like that, that really shows leadership. And similarly with service, yes, there are many opportunities, again, to make a difference. You don't have to wait for that perfect opportunity. And again, note that it's not about the title that you hold, but about what you can do. If you're serving the homeless, if you're teaching students about reproductive health, these are tangible ways of showing that you care and that you're really here as a public servant, as a doctor who is willing and able to serve the communities that you belong to. Number 5, your activities, your grades. They're important, but they don't define you. What defines you is your character. There'll be many opportunities in your career, unfortunately, where you'll be given temptations to cheat in some way, whether it's to copy papers that other people have written, to work on group projects that are not really supposed to be group projects, but you end up taking credit for. I mean, many things that you'll be given the temptation. And I'll tell you that these things happen, right? They happen later in medicine as well. When I was in medical school, things have changed a little bit. But when I was in medical school, it was very common for medical students and doctors to get money directly from drug companies that take us to games and that take us to various fancy dinners. And you have to think about where that money is coming from, right? That money is coming from your patients. When I was a medical student, my mother was diagnosed with breast cancer. And she went through many years of treatment, and she really trusted her oncologist. But then one day she found out that her oncologist was actually a highly paid speaker for a drug company. And that actually he got a lot of money for speaking on behalf of the same drug that he had given her. You can imagine how much that really made her lose trust in him, or at least began to question what his real motives are. don't be that doctor, right? Don't give in to temptation. There'll be many ways that you can do wrong, but remember that you have to stay true to yourself. And if you're doing something that you're afraid of your patients and the public knowing, then it's probably not the right thing to do. Number 6, build your community. For me, it was so critical to find mentors who really believed in me. There were plenty of people who were telling me, you cannot do this. Don't aim for that. But there were a couple people, very few, but they were there, who really believed in me and who put their faith in me. And these are the mentors who got me through undergraduate, who encouraged me to apply to medical school, and who they are the reason why I'm here today. So identify those people that you really respect and ask them to be your mentors, foster that relationship. But just as importantly, don't just look for people who are above you to help. Your peers are also mentors to you as well. I think it's fantastic, for example, here at UC Davis, that there are so many people working on getting this conference together. And these are amazing leaders who are going to be doing incredible things. And I bet you in 10 years, these leaders who you're meeting now, who are volunteering their time to put together this event, they're going to be people who are making a difference in their communities. They're going to be great doctors. They're going to be people who you will be glad that you knew when you were a student here as well. And so foster that community. And remember that it's not a zero-sum game. We're all here to make a difference in the world. There's no reason to be competitive with each other, right? Because we're all in this together. It doesn't matter that they're also wanting to go into medicine to help patients too. We need doctors far more than there are people who are able to do this. And so don't treat this as a zero-sum game. And along those lines, you have to give back. We are all here because we stood on the backs of other people, because other people made investments in us. So even if you're thinking, well, I'm just a college student, what can I do? Well, you can mentor high school students. You can teach middle school students. There are things that you can do today to give back because others have made that similar investment in you. Number 7, another word that you need to write down somewhere, and I hope you'll frame it and really take it to heart, and that word is persistence. Now, I told you my story, right, of how many people told me no. Many people told me you couldn't get it, but you know what? You don't have to get into 50 medical schools. You have to get into one medical school, right? You may apply for 60 scholarships, but you don't need 60 scholarships. You may need 1, you may need 2. Don't let people tell you you cannot do it because they don't know. Only you know why you want to be here and what you're capable of. Only you know your mission, and only you know what that difference is that you can make in this world. Don't let people tell you no. And, you know, I wrote a book last year called When Doctors Don't Listen. And in the process of writing this book, I saw also just how much persistence is necessary. People look at this now and they're like, you have this great book, you know, it was reviewed by the New York Times, Washington Post, you do all this stuff and whatever. And it's, yes, it's impressive in retrospect, but at the time, nobody knows that I contacted 30 agents to get finally somebody interested in this, that we pitched this to 50 publishers to get someone interested, that we contacted over 4,000 people to get people to write support and endorsement for this book. And of those 4,000, maybe 10 people responded. I'm just giving you an idea. I'm not saying that this is exactly the right way to do things, but I'm just letting you know, you might hear about all these successes that people have, but they don't tell you about the failures. But I guarantee you that for every person who's successful in some way, that there have been many failures, many obstacles along the way. And the one characteristic that separates them from those who didn't make it is that aspect of persistence. Of course, I'm not saying that you should not be reflective, right? If something isn't working out for whatever reason, be thoughtful about it. If you didn't get into medical school 2 years in a row, maybe you should be thinking about what you could be doing differently, right? Asking questions and being thoughtful is one thing. But if this is your dream, don't give up on your dream. Because I'm standing here today as testament to the fact that you can make it, no matter how many people tell you no, and no matter how many obstacles are in your way. I want to give you one final tip as well, and that is to embrace the things that are hard. You know, nothing that I'm saying today is easy, right? It takes a lot of courage, I think, to apply for medical school over and over again, even when you've been rejected so many times. And it takes an investment in yourself to know, hey, I'm spending all this money applying and interviewing, and it's not going anywhere, but these things are not easy. I remember Brian Stevenson, who is a famous civil rights lawyer. He was talking about the first time that he met Rosa Parks. And Rosa Parks obviously is a really famous civil rights leader, and he was telling Rosa Parks about the things that he was doing with mass incarceration and juvenile justice and all these really difficult topics. And Rosa Parks began to laugh. And she shook her head and she said, "Boy, all this is gonna make you tired, tired, tired. But that's why you have to be brave, brave, brave." And I think that's something we all have to take to heart, because everyone can do the easy things. The low-hanging fruit, anyone can do. Being a specialist who works in plastic surgery, who does all these really fancy things, those are not the hard things. Those are not the hard things. The hard things are serving patients who need your help, who nobody wants to serve. Working in communities that nobody wants to work in because it's tough, because it's hard to work with populations that otherwise don't get respect. But you know what? That's why I love my work as an emergency physician so much, because I get to treat patients who otherwise society casts aside and says, "I don't care about you. You're homeless, you're on drugs, you can't pay, why should we care about you?" But that's why that work needs to be done. And so I encourage you to persevere and to really see the patients and to advocate for the communities that other people are not working on, because really that's our job. And that's ultimately why we're here today. I leave you with one final thought, and this is not a tip, but a general idea, which is to remember what a privilege it is for all of us to be here, to have the opportunity to pursue our dreams. My parents as immigrants, they didn't have that opportunity. They worked so hard so that I could have this opportunity, so that I could have this incredible opportunity, really, to pursue my dreams and do what it is that I want to do. And I think also what a privilege it is to become physicians who are really going to be taking on the awesome responsibility of healing people, of really being advocates for our communities, and who will tackle our society's injustices. And I think what a privilege it is every day when I'm working in the ER and when I'm speaking to all of you today to serve our patients and to be helping to encourage the next generation to do the same. So I want to end today by wishing you all the best in your studies and your career. And I thank you from the bottom of my heart for inviting me to come back to you today. I'll be around for the rest of this conference. I'm actually giving a workshop right after this and some other workshops throughout the day. And I would really love to meet you. I'm also on the quad during the lunchtime, and I'll be selling my book. I would be happy to personalize a copy of my book to all of you as well. So just, I really hope to be able to meet you and congratulate all of you for being here. And thank you all for being, people who are really eager to serve others and to be advocates for others as well. Thank you. So I think that for the sake of time, I'm going to be outside. And again, I'm happy to answer any questions and also to sign copies of my book as well. Thank you.